my name is Ashley Brooke Nicholas. I am a lifestyle and motherhood blogger here in Central Florida, and I am so excited to be partnering with Advent Health for Women today to discuss a very important topic, fertility. I am joined by Dr. Samuel E. Brown today, and we are going to take our masks off so that you can hear us a little bit better and understand everything we're saying. We are properly distanced and following guidelines, so of course we're going to keep everyone safe as always. So, whether you are just starting to grow your family or maybe you've been trying for a while, you may have a lot of questions about today's topic, which is fertility. And I am so happy to be joined today by a reproductive endocrinology and infertility expert, Dr. Samuel E. Brown. He is also the medical director here at Brown Fertility in Winter Garden. It's a great resource for women in the Central Florida area, and I am so excited for today's question and answer session. So thank you so much for being with us today, Dr. Brown.
My pleasure. Thanks for having us.
Of course. Would you mind taking a moment to introduce yourself
Sure.
and tell our viewers a little bit more about yourself?
Sure. My name's Dr. Samuel Brown. I'm a reproductive endocrinology infertility specialist here in Central Florida, North Florida, and Tampa as well. And we help lots and lots of couples have families. And we're a fertility specialist, and we have a lot of success, and we enjoy what we do.
That is amazing. It is so good to know that the women of Central Florida have access to an expert such as yourself in such an important area. So let's go ahead and jump right in. If you are watching from home and you have a question, feel free to leave it in the comment box below. We'll get to as many as we can throughout the video. And as always, I want to remind you that today's discussion is an open forum and should replace medical advice. We always urge you to consult your doctors directly if you have a question that is specific to your personal health. Okay, so let's go ahead and get started. Today we are talking about infertility and trouble conceiving. And so I thought we'd get the discussion started with just probably one of the most common questions, and that is if a couple is deciding they want to try to grow their family, how long should they try to conceive before they need to, or before it might be wise to seek the support of an expert?
It's a great question. And for women under 30, for couples where the woman is 35 and under, it's 1 year, just 12 months of just random unprotected intercourse. If they're not pregnant, they get the diagnosis and they should come in for at least diagnostic testing and a discussion.
Okay.
For women in the couple coming in, if the woman's older than 35, it's 6 months of unprotected intercourse. If they're not having success, then they should seek the advice of a fertility specialist.
That is great information to know, and I'm sure I know that I've been in those shoes myself where you try to conceive and it doesn't happen immediately
Right.
and you think there may be an issue, but it's good to know there is a time period where it is normal. So depending on your age range, follow Dr. Brown's advice. If nothing happens, go ahead and seek the support of an expert and they can help give you a more specific diagnosis.
Just as a quick add-on to that, for when the couple comes in and the woman's 40 and above, it's immediate. They shouldn't wait 6 months. I think that's important. The female, the woman's age is really, really important. And if, so again, under 35 years of age, if the woman's 35 or under, 12 months of unprotected intercourse. Between 35 and 40, 6 months of unprotected intercourse without success. And for women over 40, there's no delay. They should come in immediately.
That is great information because we are all in different timelines, we're all at different stages of your life, and wherever your family is in that timeline, go ahead and follow Dr. Brown's advice. It may be a little bit different based on your age, but that is a great place to start. And now along those lines, we all know it can be more difficult to conceive as we get older. What is exactly the role of age in fertility?
Yes, that's a great question, and I get that question every day. And the age part is, it's not the man, it's not the age of the sperm that matters so much. Gentlemen are lucky, they continue to make sperm pretty much into their 60s and 70s without any issues. And for the woman, the age of the uterus doesn't matter that much. The uterus is pretty easy to work with, and we let women get pregnant under age 55 by our current standards. 55 and under is acceptable from the ASRM, American Society for Reproductive Medicine. But what's really critical is the age of the egg. A woman's born with a barrel of eggs, and unfortunately, this study's been done around the world. But when the woman reaches 40 to 42, we're at the bottom of the barrel. Those eggs don't want to do the job after 42, 44. We consider 44 the end of the road, where 99.99% of women will not get pregnant with their own eggs after age 44. So unfortunately, there is this clock ticking. And but in general, the way a fertility doctor looks at a couple, again, we run to see the age of the female, because that's really telling us how fast do we need to work here, and if we're in trouble or not. But in general, the woman's 25 to 45 years of age, and if the woman's 25 to 33, she's considered young. Her eggs are wonderful. They usually get pregnant pretty easily one way or another with some help. If she's 34 to 37, that's kind of 33 to 37, that's kind of middle age. They do fine. But 38 to 41, things are going downhill quick. Still not too late, but that's kind of how we feel as fertility doctors when a couple comes in, when we judge that woman's age and what's going to happen here.
That is really great to know, and I think it always helps to be informed about your current situation. We can't change our age, we can't change where we are at life, but being prepared and knowing what the situation may be related to your age is going to help you know how promptly you need to act, and it's going to help your doctor create the right plan for your family and the right level of urgency, because the treatment may be different if you're younger versus older.
Absolutely.
That's amazing.
Perfectly said.
Okay, so I'm so happy we're getting into this, and we did have some readers send in questions.
Awesome.
But before we get to that, I wanted to cover two common questions because people had asked about this, and,
Sure.
and I think it's better to cover them bravely, but I wanted to drive this home because I don't think it's talked about enough. How common are fertility struggles?
That's a great question, and in the United States and in most countries, in general, it's approximately 10% of the population. Some would argue it's 1 in 8 couples have trouble, but it's age dependent, as we were just talking about. But so in general, 10% of all couples have infertility. Now, if you categorize it on the woman's age, for women under 35, with a couple in such the woman's 35 or under, it's 10%. But if the woman's closer to 40, it can be 25%. And if the woman's over 40, it's up to 50% of those couples will actually have infertility. Yeah, it's very age dependent on the female again.
That is good to know, and I think it's, even though, you know, on the surface that may seem like, wow, that's a really big number if you're trying to conceive, but I think it's really good to know as you're thinking about growing your family and knowing this is very common. So if you are at home, if you are worried about this, or if you are experiencing infertility struggles, you are not alone. This is a very common problem, and as women, you know, it is amazing the advances women have made in their careers and things, but it has changed the average age of women trying to conceive, and so I'm sure it's become more common.
It is, like you said perfectly, it's not a rare thing. This is not somebody needing a liver transplant or something. It might be more rare. This is your neighbor. This is your family member. This is your friend. 10%, that's a lot of people. So, and the beauty is with treatments, almost everybody has success one way or another. So there's good positive outcomes from all this.
And that's, I think, the real positive note on this is, yes, it is a widespread issue, but there are known research-supported treatments that can help you, and it's, you know, there's lots of hope in this field. So along that note, before we jump into the reader questions, what are some of the common causes of infertility? I know we talked about just age, there's a natural relation to infertility, but are there other common causes? Yes,
and it's interesting. There's different, the man is the problem almost half the time. So 40% of the time, it's the male factor or sperm problem. So it's one of the first tests we do is a sperm test, and guys are reluctant to do that, but it's so important. I mean, 40% of the time it's the guy. You know, we're talking about blaming the woman's age right now, but 40% of the time it's the guy. And then for the woman, the other 40% of the time it's just solely the woman, and 20% of the time it's both. It's the man and the woman. So, but in the common causes for the woman on the female side of things, can be endometriosis is very common. We see probably 25% of our patients have endometriosis. Tubal occlusion, their tubes are blocked. they don't. A really common problem is where they don't ovulate properly, where the woman has plenty of eggs and she's just not popping them out properly. And there's a common term for that called PCOS, polycystic ovarian syndrome, which is a great topic we should discuss eventually. And just ovulation problems, or the woman's out of eggs. These are some of the common issues that we see.
That is amazing to know. And we actually just did a really great endometriosis Q&A. It's available on the Advent Health for Women Facebook and Instagram pages. And the doctor was amazing, and she did cover just a vast array of question and answers on endometriosis, and she touched on infertility.
Wonderful.
But that is a great resource if you suspect you have endometriosis, or if you know that you do. I would highly encourage you to look at that, because she answered a lot of that in depth.
Awesome.
So now I want to jump into a few common questions that we got from readers. And what I noticed was a lot of people had very similar questions, but from different angles in their personal lives. So I'm going to try to lump them together. But one of the main themes was women who are not in a place in their life where they're ready to try to start conceiving right away, but they are worried about possible infertility for a variety of reasons. We've covered age. Some people had specific medical conditions that they weren't sure, medications that they were on. If someone is not ready to conceive, but they either know they have a condition that could cause infertility, or they suspect for whatever reason they might, is there any, I guess people are wondering, is there anything that they should proactively do before they're in a place in their life where they're ready to conceive?
Yeah, it's a great question. So those that perceive that they may have some difficulty, it's really a simple answer. Come in and see us. Come in and have a consultation. We're not going to force any treatments on you immediately. No way. And just to plan for the future, there's lots to discuss. We may find that issue you were worried about was nothing, and it's actually something else that we have to be concerned with that you didn't see coming. And also, what's really popular is fertility preservation. So it's the standard of care. It's not experimental anymore as of 2014, but women under the age of 37, all OB-GYN doctors are to discuss this with their patients, that, hey, if you're going to delay childbearing or family creation, consider egg freezing. So almost all big cities in the United States are doing this very aggressively, and in our smaller cities where it's just now coming in, but we've been doing it for 20 years, egg freezing. And that also becomes part of that fertility planning consultation, or to discuss what issues might be at hand.
That is really powerful
fertility
information.
Preservation is very important.
Yes, I completely agree. I think that's great information to have. If you are at home and for whatever reason you're worried about potential infertility in the future, I think what Dr. Brown said is so important. There is no need to sit and worry about things when you don't know what's going on. So even if your family is not ready to start trying to conceive a child, go ahead, go in, be seen, get some preliminary testing done, because there is so much power in knowledge, and you can know, like you said, maybe there's nothing at all. Maybe there's nothing for you to worry at all. That's the best case scenario.
Yes.
And if there is, you can create a plan with your doctor and prep for the future in a way that's comfortable for your family's plans. And I think that is so good to know that there are options no matter what the situation is. So.
And OB-GYN doctors are really good at it, but we enjoy it tremendously as infertility specialists, just to have a couple in front of us that may not have a problem at all and just wants to plan their family. So family planning purposes, we love that. Just like you said, perfectly said.
And you know, I'm certainly not an expert. I've been blessed to have 2 children of my own, and you know, I've spoken to other moms that are like, I wish that I would have discussed some of these things even before. Maybe they had problems, or maybe they didn't, but it certainly couldn't hurt.
Absolutely.
And it certainly would have helpful to have some expert guidance on creating a plan that's optimal for your family. So another question that was fairly common is people want to know, what are the current recommendations for the COVID vaccine, specifically in relation to women who are trying to conceive, or potentially women who may have suspected or known infertility issues?
Sure. The pandemic has been scary, and thank God, I think we're coming out of it. I'm not an expert with that, but I can tell you the American College of OB-GYN, who pretty much governs us, we call them ACOG, ACOG, you can look this up online. they show the science is very clear that if the woman wants to be vaccinated, she should. That's pre-pregnancy, during pregnancy, or during lactation. It's quite all right. There's no negative. And we endorse it. We recommend it. So if you want to get the vaccine, please do.
That is great to know. I love that it's clear-cut information. It is recommended no matter what stage of your conception journey is. So that is great to know that there is just a blanket recommendation for everyone that makes things
And there's
easy.
a general paranoia out there, and we're not, we're a very high volume fertility practice. We see lots and thousands of infertility patients, and we've seen thousands who have had vaccines, who have had the virus, and I haven't seen a single negative. Babies aren't getting this. There's no birth defects. There's, in pregnancy, it doesn't seem to be an issue at all. So younger, healthier people, which I think our fertility population patients are considered younger and healthier people, it doesn't seem to be a major issue at all. So I hope we can get over this paranoia that exists.
Well, science is amazing, and I think new breakthroughs are coming out every day, new research, and I think, like you said, we're going in a positive direction, in the right direction, and it's so good to know that positive news about the fertility community. Now, another common question that we had is people who are maybe not worried about infertility, but they know they're getting older, they know things change over time. Is there anything a woman could do to increase their fertility, whether or not they have a problem? Maybe if they don't have infertility issues, is there anything to boost it? And if they do have known infertility issues, maybe what are some of the common treatments?
That's a great question. In general, anybody that's considering getting pregnant, before they get pregnant, we want them to start a prenatal vitamin, or at least folic acid, 2 or 3 months before they get pregnant. So if they're even considering it, just go get an over-the-counter prenatal vitamin and start it immediately. And when you do want to get pregnant, when you're ready for some active involvement, even if you don't have infertility, I recommend the urine ovulation predictor kits. At Walgreens or CVS, it's 20 sticks for $20. You can go to the dollar store and get them. Start checking the woman's urine once a day on day 9 or 10 of her menstrual cycle. And I have to clarify what a menstrual cycle is. And my alphabet is a woman's cycle. And the first day she has her period or has to wear a tampon or a pad, we call that cycle day 1. The next day is cycle day 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 13. We don't care when she stops bleeding. We keep counting. And where it's important is I may ask the patient to do something on cycle day 21 or cycle day 11, and that's all in reference to that first day she had to wear a tampon or a pad. So the general recommendation is to use a urine ovulation predictor kit, just the cheap ones, starting on day 9 or 10. Every day, once a day, dip the urine. If it turns positive, stop testing and have intercourse that night or every other night for 2 or 3 events. And that's all that's necessary. And from whenever the urine turned positive, I call it sweet 16. 16 days later is the earliest to check a pregnancy test. And if she's pregnant, have her go see the OB-GYN immediately, or if she's under the care of a fertility doctor, they would come see us immediately. 16 days from when the urine ovulation predictor kit turned positive. So that's what we're supposed to do with fertility counseling for those that may not have problems, is to target intercourse with ovulation that way.
That is amazing, and it's a great way to start, because I know certainly when I was having my first child, I didn't have a set plan, and things like that really helped. It helps empower you to know I'm doing this the right way, and just gives you a little bit more information. So that is a great tip. Now, conversely, someone had asked, is there anything that I should not be doing? If I'm planning to conceive, is there anything that I should stop other than the normal recommendations that might negatively affect my infertility?
Yeah, that's a great question. Alcohol and caffeine are a concern, more so on the female. After ovulation, when this fragile embryo or egg is getting fertilized and becoming an embryo, when it's trying to implant, alcohol is not friendly. And that's a myth I dispel every day. Everyone thinks, what does your neighbor tell you? If you're having trouble getting pregnant, the neighbors say, oh, you're just too stressed. You just drink alcohol. No. Alcohol is embryotoxic. So for the woman, drinking in that luteal phase or after ovulation is not wise. Gentlemen are, of course, we're to tell them to drink less, but it's a little less aggressive, harmful for the man. Caffeine, 1 or 2 caffeinated beverages a day. I like to recommend 1 caffeinated beverage. Too much caffeine can be a problem, but I think alcohol is more of a problem. Smoking, of course, is very bad. You know, whatever medications it takes to stop smoking, do it. I mean, smoking is the devil. Smoking cigarettes or tobacco is the devil. Marijuana is also bad. It's a negative as well, but not as damning as nicotine. And that's pretty much it. You know, if the woman's exercising, it's okay to exercise. Especially if she's heavy and she's not ovulating properly, we recommend a dieting and exercise program. But in general, if the woman doesn't have an ovulation problem and she has regular periods, when they come to see a fertility specialist, we tell them just continue with the exercise program they're on. I wouldn't start anything new. So that's important to know, just to continue what they've been doing, and not, as they're entering fertility treatment, not to start a new exercise plan or extreme weight loss plan.
All of that information makes total sense across the board, just to improve your overall health. Whether you're trying to conceive or not, all of those things are probably healthy, and it's probably going to put less stress on your body, which is going to be ideal if you're trying to conceive. So those are really great tips if you're thinking about growing your family. Maybe make some of those lifestyle changes beforehand, and definitely once you've started the process. So that is great to know. Now that we've sort of discussed some of the common causes, how common infertility actually is, how, let's say a woman goes into their OB-GYN and they discuss these things and they refer you to you. How do you work together with their OB team, and does that change throughout the pregnancy process?
It's a great question. And typically patients will come in without a referral from their OB-GYN. Probably half the time they just call us directly and come in because they know there's a problem. And probably half our patients come in from a referral from an OB-GYN or a family practitioner, sometimes a urologist. And we help the patient, we do the testing, we find out what's the problem. And most of the time, most couples don't know what the problem is. And we have a few simple tests that insurance pays for typically. And we can usually identify the problem. And then we find the cheapest way out. And most couples actually take the cheaper treatments and not the more expensive treatments to have a baby. And once they get pregnant, we'll do their first ultrasound to make sure that it's a proper pregnancy in the uterus and not a miscarriage. And then we hand them back at 6 weeks, or somewhere between 6 to 8 weeks of pregnancy, back to their OB-GYN of their choice. And then they have a normal obstetrical experience.
That is great to know. So it works hand in hand, and whether you want to go through your doctor, your normal OB-GYN, if you're not sure about, if you're someone who might need fertility support, or if you want to go straight to Dr. Brown at Brown Fertility, or whatever a clinic is in your area, either way seems to be fine, and they can get you the help you need, and they're going to work hand in hand with your existing team. Now, I know you were discussing some of the different ways that when people have these diagnoses that they can conceive. I think 2 of the terms that I hear thrown up most are IVF and IUIs.
Sure.
Could you discuss those, what the difference is?
Yeah, and I feel bad for patients. All these acronyms are kind of scary. I mean, when you hear OB-GYN and IUI and IVF, I mean, I don't want to sign up for IV anything. I mean, it sounds scary. But to make things short, we have acronyms for everything. And IUI, or intrauterine insemination, is a very affordable, it costs a few $100s to concentrate sperm and place it into the uterus. Other ways to name that are inseminations or intrauterine inseminations. We make sure the woman's ovulating, and you just place sperm into the uterus at the right time. It's very simple, very, very affordable. Actually, most of our patients get pregnant with that process.
Well, that's good to know.
And for those that have more serious concerns, like really bad sperm, or their tubes are blocked, there's other scenarios, then they may have to go to IVF. And what is IVF? Well, IVF is in vitro fertilization. Well, that doesn't help me. That's still a scary name. In vitro fertilization. What the heck does that mean? They should have called it assisted reproduction. But that's where we gently use a needle to get a few of the woman's eggs, fertilize those eggs outside of the body with the husband's sperm, and then a few days later place those back into the womb. And pregnancy rates are outstanding. You know,
amazing.
for women under age 35, success rates will place one back into the uterus, and success rates range to around 80% per try. And it's become more and more affordable over time. So more and more people can access this, which is great.
That is amazing to know. There are options available to you if you have infertility struggles. Some of them are more affordable than others, but they are simple, they are proven, and they are effective. So that
just to follow that real quick, now insurance companies are actually paying for this more and more.
That's amazing.
I think 50% of our patients now, insurance pays for all of that. And the couple doesn't know that, so they're afraid they're going to get in trouble financially. 50% of the time insurance pays for all of these things now.
That's incredible.
And you know, 5 years ago it was 20%, now it's 50%. I think, and more over time will be covered with insurance. So there's not that financial burden or financial anxiety that a lot of couples have.
That is
coming
incredible.
In to see a fertility doctor.
Just to increase the range of people who have access to this. I would also encourage you, in addition to speaking with your insurance provider, speak to your employers, because some employers also offer a benefit. I know I have had friends and family who were very surprised that it snuck into their benefits package was a support for this for infertility. So definitely reach out to all of the resources that you have, because you may not know that you are covered for this. If you haven't had issues in the past, it just may not have come up. Now, I know you had also talked about egg preservation, and I wanted to talk about, people hear about freezing their eggs. Is that common, and how would someone know if that's a right fit for them?
Sure, it's a great, and we really need to be aggressive with educating people about this. It's no longer experimental. As of 2014, egg freezing is now a standard of care. And all OB-GYNs are to bring that up in every time they have a consultation or a pap smear with a patient, they are to discuss fertility preservation. It's what the American College of OB-GYN has told them. And it's, every woman's different on their family plan, on when they want to have kids, if they want to delay childbearing, or, but egg freezing is now standard. It's not experimental. It's for women under age 38.
Okay.
Under age 38, it works really well. For women over 38, not so well. A patient comes in and they do what we call the IVF process, but it's pretty simple. It's just a few days of some medication, and then there's IV sedation involved where the patient won't feel things, and we just gently place a needle into the ovary and get the eggs and freeze them. Then they're frozen in time. They don't age, they don't freeze or burn. So if the 33-year-old or 28-year-old woman freezes her eggs or cryopreserves her eggs, she can use them at age 45, and they would still have the pregnancy potential as if she was 32 or 28, which is wonderful, where after age 40 it's not so good if she were using her 43-year-old eggs or 45-year-old eggs. So it is getting very popular in the United States, and it's a nice security blanket where you don't have to rush your family if you're not ready to have your family. We highly aggressively recommend it.
That is amazing to know, and I think it is a great option. I have so many friends who are in that position, so if you're interested in that, speak to your doctor, because it sounds like a great option. So thank you so much for being with us, Dr. Brown.
My pleasure.
That is all the time we have for today, but I truly appreciate you taking the time and for opening up your beautiful clinic, Brown Fertility, for us. It is a great resource for the women in Central Florida. And on that note, I wanted to note for my friends in Winter Garden, as I was walking to your office today, I noticed it's right next door to the Advent Health Medical Group OB-GYN, which is the practice that I go to. Their Winter Garden office is literally right next door, so I love that women can get comprehensive care all in one spot. And no matter where you are in Central Florida, Advent Health for Women has an amazing network of care, so you can get the care you need conveniently no matter where you are in the area. And if you have further questions about OB-GYN topics or any medical topics, I urge you to take advantage of their free complimentary service, the Women's Health Navigator. You can go to herhealthnavigator.com. They can help you find appropriate medical care for your needs or your family's needs. They can answer some of your medical questions, and they connect you to great people like Dr. Brown and other experts in the field. And they can also give you some great resources in your community. And as always, I encourage you to follow Advent Health for Women on Facebook and Instagram. They are also always sharing amazing information for women of all ages. Thanks so much.